We can start. So we have 3 speakers today. The first one will be Stéphane Spahni, who is an IT architect at the Geneva University Hospital and also IHE-Europe Deputy Co-Chair. He will be presenting what is a projectathon and more specifically the Swiss projectathon. And then we will have Thierry Dart, so Director of Medical Affairs and Labeling Department at the INS, which is the national French agency, and his colleague Maëlle Prieur, that's Project Manager at the INS also. So I will leave the floor to Stéphane to start, and you should be able now, Stéphane. Perfect, thank you.
Thank you, Sophia. Good afternoon, everybody. So I will present first a bit the projectathons and then move to what we do in Switzerland in this regard. If you look at some key steps when you are making a project, the key ones more related to IHE, you have to select the standards, you define the use cases, and out of that you can start your implementation. And then you need to validate your implementation. So there you will have connectathons, you will have projectathon, and you have pre-production tests. So we'll focus on the 2 low boxes, which are part of what we call the IHE testing continuum. Testing continuum is here for, as the name says, testing the implementations. And you have different parts, different building blocks for doing the testing. You have enablers. You can start by participating, for example, to Fire, HL7 Fire Connectathon, to Plugathons, other hackathons or other connectathons. Then you have the central part is the key tools parts of the testing continuum. The connectathon and projectathon, but you also have other tools like the Sherazone, more for testing in relation with imaging. You also have the IHE conformity assessment, which will not speak of it today, which is more conformity assessment of a product. Both connectathon, projectathon, you have results that are published or published under the project. The conformity assessment makes a product labeling. So goal of the connectathon, which are similar to those of the projectathon, is really to promote the interoperability through the adoption of the common standards, the IHE profiles, to validate the conformity or the good implementation of the profiles. With standalone tests, you will test, for example, if you produce a document, you will validate that the structure of the document is correct, that the content is correct. So that's what we call standalone test. You can also do some tests against simulators. When you implement an exchange between 2 parties, you generally implement one of the 2 parties, and you test against the simulator of the other party. And then during the most important phase during the connectathon is the testing against other implementation, because we know that if we test only with our own implementation in a closed box, we will not discover many mistakes, many problems. So it's very important to test against other implementations of the same profiles, other peers. Projectathon is exactly the same. Simply, while the connectathon is more generic testing, you test the IHE profiles like there are. In a projectathon, you will test in a specific context, like we will see after, the Swiss context or the French context. But so there are small differences between the 2. Governance of a connectathon is under the IHE Regional National Deployment Committee governance, IHE-Europe for Europe, IHE North America for the North America, IHE Japan for Japan. while the projectathon is under the project governance, like the INS in France, IHE Swiss in Switzerland. The criteria for success, for having a successful testing session, it's for the IHE test methods and the criteria developed in relation with each IHE profile for the collectathon. In a projectathon, you may have some specific rules linked to the project to which you are participating, or some specific extensions linked to the project. And results, the IHE Connectathon results are published in on an official site of IHE. Publication of results of a projectathon, it depends on the project. It's the project that has the lead for publishing or not publishing the result of the projectathon. There are a certain number of projectathons now. There is the one in South America, Canada Health Infoway, WHO, European Commission through the myhealth.eu is also doing projectathon, and the INS projectathon in France, the EPR projectathon in Switzerland. And the list will certainly grow over the years. But as I showed, there are small differences between the two, but if we look at concrete realization, you have pictures here from the last two connectathons, the one in Montreux, the one in Rennes. But in both cases, you have in the left tables in Montreux, where for the Swiss EPR projectathon, the room which is just on the right of the top image is this one, which where there was the ANS, the French projectathon. So it's basically the same kind of events. You have the different developers, the different systems that are coming, and which will do a certain number of tests together against the other, and using the same kind of tools. So going more specific to the Swiss EPR projectathon, as I mentioned, it's related to a specific project, specific environment, and for us in Switzerland, the project or the environment is the electronic patient record federal law, which was published in 2018 and in force from April 2020. The context is a bit different from the one, for example, in France. We have national regulations, but we have regional implementations and regional responsibility of the implementations, which lead in Switzerland to several electronic patient records communities, which are XDS affinity domains, so separate implementations, separate systems, separate environments, but that have to be interconnected, that have to be linked together, because a user should never know that there are different communities over the country. A patient in Geneva going for care in Zurich do not have to know that it's not the same community, that the professional is not in the same platform as him. It's a whole, and it has to be transparent for the users, both the patients and the healthcare professionals. So we have now 8 of these different communities, 8 that's regional communities. Each one is implementing its own set of services, it has its own implementation of the EPR services, of the management of a community, of the onboarding of patients, onboarding of physicians. Everything is multiplied by 8, but all these have to work together and from the outside be seen as one big EPR platform, EPR community. Every community is based on IHE profiles. That's part of the law. There are a certain number of mandatory profiles, quite a lot of different profiles. There are also national extensions about the access log, about the management of the index of healthcare professionals, the management of the access rules, the policies, and some central services for managing the national patient identifier. So part, let's say, standard according to the international IHE profiles, and some specializations, what we called volume 4 for the IHE profiles, or specific Swiss profiles. Every community, every technical platform has to be certified. The processes, the implementation of the standards, the implementation of national extensions, and of course the interoperability between the different implementations. All that has to be certified by a certified auditor. Primary systems making deep integration also have to go through a bit limited, but still a certification, technical implementation of the interfaces with the community. The processes, the administrative processes are certified, and this audit is performed at least every 2 or 3 years by a certified auditor, and in between by the community the primary system is affiliated to. So then there's a question, how can we support the implementers and the certifiers, because they have to certify that a platform that also the technical implementation is corresponding to the specifications, so the IHE profiles and the national extensions. So there is the generic testing, where the software providers can do the generic testing of their implementation of the IHE profiles through the connectathons. But we also have the Swiss Projectathon, where we do the EPR-related testing. So same model as the connectathon, but the test plans are tuned, are designed according to the EPR use cases and the national complements and the national profiles. Projectathon may be run parallel with the IHE Connectathon, so same time, same location, like in Montreux in last year, or independently, like this year, as the Connectathon was in Rennes, we had a Connectathon in Bern. In both cases, we are using the IHE Gazelle platform, the IHE testing tool platform. For the APR-related testing, so we have a selection of the mandatory profiles corresponding to the implemented domains. We do not test in the Projectathon profiles that are outside of the scope of the original project. There are also some restrictions in the transactions we will test. For example, for the patient identity or the patient demographic query, we are using the specifications based on HL7 v3, not v2. So we will test only PIX v3, PDQ v3 transactions and not the others. And that's also valid for other profiles, national extensions. And so we have a current set of profiles and transactions for the Projectathon, which really maps the needs of the project. And in order to do this test in the best, with the best environment possible, we have a reference implementation, which is made out of the testing tools, the IHE Gazelle testing tools, but tuned, configured with the Swiss profile. So proposing only the EPR used transactions and based on the national extensions, national specifications. Also have a set of samples based again on the national specifications. The Projectathon itself is organized every year since 2017, 1 week like the Connectathon. It's in autumn, and the key use cases we're testing is the patient management, document management, and healthcare professional directory management. The participants are a few primary systems, DPR platforms implementers, and central services. We are trying to get more and more primary systems so that they can validate also their implementation. We had collaboration in 18, 19, and 22 with the Connectathon. So like I showed the picture for Montreux, where we do in the same room. So we share the same technical infrastructure, and we can have also, which is very, very interesting for every participant, synergies with the IHE Connectathon participants. So each one can have a look, can know what the others are doing, and some companies are participating in both the Connectathon and the Projectathon. We have also started in 21. We had an e-medication Projectathon in spring because we were just starting the e-medication testing. Now it's part of the national EPR Projectathon every year. So it's one aspect of the EPR Projectathon for the e-medication. The Swiss Projectathon is organized as it's a partnership between EL Swiss and IHE Swiss, and it's implemented by IHE-Europe, IHE Catalyst for the technical platform. EL Swiss is more the main organizer, the sponsor, and IHE Swiss has the technical project management and all the support related to IHE. We also have some additional testing events that's linked to the structure of the law, where the communities are responsible for allowing primary systems to connect to the EPR platform. So they are validating the technical interconnection of the primary systems with the DPR community, with the DPR technical platform. And we do not follow for that a one-year cycle because primary systems may be ready at any time. So, for example, for the French-speaking community, which is called CARA, from which I am a member, we organize periodic what we call Carathon, which is, again, it's a small projectathon with only one primary system and the community, and we test all the profiles implemented by the primary system. They may have a partial deep integration, so we test every transactions they are implementing. And we do not have the monitors like for the projectathon, but it's the CARA technical team which is doing the validation. And for that, we are, that's why also I mentioned that we have developed a special toolkit. We are testing a primary system against the technical platform, the technical instances of the EPR platform and the identity providers. And CARA has developed a proxy, which is called EPR integration kit, which is in between the technical platform and the primary systems with two goals. One is to intercept every request and response and validate it with the Gazelle tools. So every message, query and response are validated with the IHE Gazelle tools. And you have, through a web page, you have a report with a link on the Gazelle test instance. And it has also another functionality, which is to help in the early phases, the primary systems implementers by providing a certain number of functionalities, especially linked to the IDP, where they can simulate the user's authentication and all the burden of the certificates, the SSL certificates. They can be managed at the API integration kit level for the initial development phase. Of course, when we do the testing, the primary system has to implement all that, and it's just used as a proxy for linking with the testing tools. But it's very useful for that. And that's it for the Swiss Projectathon. and I will leave the floor to my French colleagues, and we'll take the questions after.
Thank you, Stéphane. Maybe I will share my screen for you, Thierry and Maël. You are all able to see it?
Yes.
Yes, thank you. Good morning, everyone. I will explain how we organize a French projectathon, why and how. I will be with my trio. Next slide. First, we are the French IHE agency. French IHE agency is a national government agency. We have a free mission, and in the mission of to regulate, we have two frameworks, one for interoperability and one for security. We are also a member of IHE and at level 7 at the international and national level. Next slide. In terms of interoperability, we are profiling, and most of our work we are writing a national extension of IHE profile. We are also distributing terminology. We are testing, and by testing, we have a national platform for testing, and we are organizing each year a projectathon, and we are also have a certification process. Next slide. In France, at the national level, the law established a French e-health identity number called INS, Identifiant National de Santé, and a practitioner directory. We have also what we call a DMP, Dossier Médical Partagé. DMP is a national XDS repository of CDA document. It's in production since 2011. And we use CDA profiling. Most are only PDF, CDA with level 1, I mean PDF, but some are level 3. And we use biological report in level 3, immunization report, and a child health report, and a copy also of prescription and dispensation. We have also at the national level a secure email system for practitioner called Messagerie Sécurisée de Santé, and we have a third system, Mon Espace Santé, for patient with a patient calendar based on FHIR. We have also a viewer CDA document, so a patient could see the document in the Dossier Médical Partagé. And you have a small component also of patient health record. Next slide. In France, regulation is national. Implementation of this free system is at a national level, and we have a national interoperability framework where most of our job is to do profiling. Most are IHE national profile extension of international profile. We also have some profile based on FHIR implementation guide. We have this national interoperability framework since 2009. We have a national projectathon, annual and national projectathon. We have also an interoperability platform, and we have also a terminology server. And we have a certification process for since 2021. Next slide. I will not go in detail, but here you have the main component, the main interface, and the name of the profile we use. Most are from IHE. So we have at the center the DMP, the CDA repository of documents using XDS repository, connected with professional software on the right and also with patient software on the left. We have also a patient space, Mon Espace Santé, with a fire registry for vital sign and for calendar. Next slide. We have been organizing projectathon now since 2020. It's a national projectathon. It's on most use cases are based on DMP, Mon Espace Santé. We are also organizing testing for project for testing, for example, directories, sharing image also, and the testing tool is based on Gazelle. We are organizing projectathon by ourselves and also connected with IHE-Europe Connectathon two times. And the last time it was this year in September with the same case. And the idea is to create synergy with the IHE community during the European Connectathon. Next slide. What are the benefits for vendors of a projectathon? For vendors is to test the compliance of the system. Is also to report to us any correction or evolution in our specification, and that's very important for us to have a feedback from the vendors, from the developers. For the vendors, benefits are also to meet and to test their software, to meet our team, and this is a free event. There are also other benefits for us is to improve the maturity of our specification and to respond directly to the vendors. There are also interests for the monitors. This interest is to improve their level of expertise and to meet vendors and monitors. Next slide. So we organized the first French projectathon in Rennes a few years ago. We were testing only 2 profiles, and we have only 8 vendors. And the last projectathon in Rennes in September, we have been testing 36 profiles, and we have 45 vendors. So quite huge projectathon for this year. Next slide. So the last French projectathon, 45 vendors, more than 200 people. You can see a small screenshot of the French projectathon in Rennes. 370 tests, many message exchange on the coordination tool. We also organized 10 workshops about interoperability, and of course we had a satisfaction survey. Next slide. What is very important in a projectathon is the organization, and by the organization it's quite very long and complicated. I mean, we organize each year a projectathon, and organizing a projectathon is 4 or 6 months of preparation. Our projectathon is virtual and also face-to-face events, so we need a tool to coordinate virtual and face-to-face event. There are many monitors, and there are also monitors from regional organization in France. So we have many monitors in the French projectathon. Why? The idea behind that is to help the vendors. I think projectathon also is also a way for us to help the vendors. Using the tool, we have a national platform testing tool based on Gazelle, and we have also two coordination tools, Slack and a Teams. And as you see, for testing 36 profiles, we have also more than 200 testing models. So the organization is quite huge and complicated. Do not forget, you have to organize. It's long. Next slide. In parallel, we have also a certification process. I will not go in detail, called Ségur de la Santé. This is a short view of the main domain of the Ségur stage 1, so the first stage of the certification process. As you see, many things are based on IHE profile. Next slide. The interest is to connect testing projectathon and testing for certification. As you see, this is a number of tests done in our integrated testing platform in Gazelle. As you see, you can see the increasing of monthly number of tests during the certification stage 1 and during the certification stage 2. The certification stage 2 is only a preparation testing stage actually. Next slide. And what are the effects of the projectathon on the certification process is a number of CDA documents in the DMP, in the Mon Espace Santé. As you see, we have an increasing of the number of documents in this national CDA repository. Next slide. Of course, this work is done by a team, and this is our team at INS. Next slide. Well, thank you for all. Thank you, Sophia, and thank you for your attention. If you have questions, of course, do not hesitate.
Thierry, there is a question, and I think you might be the one who can reply to it. How are the projectathons positioned in respect to your mandatory certification? What is the interdependency?
Well, what are the position is, well, the position of a projectathon actually is to help the vendors. I mean, we do not publish the result of the test. We publish only the participants, the vendor participant for testing. And during the projectathon, the vendors are testing their software. And during the certification, they will pass the certification. For us, the projectathon is a tool to help the vendors to pass the certification process. It's a training.
But a training really towards the certification, right?
Yes.
Jan, I will disable. Yeah, your microphone is enabled, so you can speak up. Another question that we have in the chat: do you have requirements to have tested an IHE profile before it can come into your projectathon?
No, for the first projectathon, no. The idea is to help the vendors, so we have no requirement. The idea is to have the 3 days with the developers for 3 days to help the developers and the vendors to implement the specification. There is no requirement.
It's the same situation in Switzerland. So
hello, this is Jan. Can I ask now, or because
Yes,
I've managed to be double muted. I would like to ask. First of all, I was saying thank you both for both presentations, and my question would be like one step lower than being a country that is already able to organize a projectathon. What would be the requirements? Should there first be a boot camp where people would at least understand what is Gazelle, how to connect to it, or it's okay to go straight into projectathon? What I mean is, if you're in the stage of thinking about implementing something and at the same time saying, look, we will be starting to implement this, and in 2 years' time, we will be testing it, and there will be a projectathon. Start to prepare for it. Start to prepare for it now. What would be the best steps for that?
well, for Switzerland, we did not have any boot camps. We more or less assume that if a software provider is implementing something based on the IHE profiles for the project, that they already know, that they already did an initial step of looking at Gazelle and how to test through the Gazelle tools. It may be useful, interesting if you have depending on the level of knowledge you have in the country. I can make a parallel with the IHE-DSI, the cross-border e-health infrastructure. The first year we did a boot camp to train, because there was only a few persons that was aware of the installation of a national contact point, how to validate a few things. And then there was the projectathons, but then the knowledge, or there was enough people knowing how to participate, how to do the testing, and then it's a mutual help between the participants. So it's not a prerequisite to make a boot camp. It depends on how many people you have who may help each other.
Well, for side, I think we do not have a boot camp also. I think one of the, well, go on, organize your first projectathon, and with only maybe 1 or 2 profile. For us, for the first time 5 years ago, it was only 2 profile, 8 vendors. So it's why it was very small. Organize it. Don't forget you have 4 or 6 months of preparation. During this preparation, you have to communicate to the vendors. We are organizing typically 3 or 4 webinars. 3 or 4 webinars to recruit vendors, also to explain how to use Gazelle. So it's very important. I think the best way is to organize a small projectathon, 1 or 2 profile on.
Thierry, you've expressed already a couple of times that it is a lot of work, a projectathon, right? But it is, of course, in the lifeline of a project, right? But do you consider the efforts worthwhile the outcome?
Well, no, I consider it's mandatory to organize a projectathon. Why? Because it's also for us a way not only to test the vendors, but also to help them, but also to improve our specification. It's a good way for us to have exchange with the developers. It's a good way to understand how the implementation is done by the vendors. So it's for us very important to organize each year a projectathon. For example, for this year, we have published two correction of profile this month. So it's very, very important to exchange to see how the developers are using our profile. So for us, a projectathon is a part of a project, and also it's a part of the specification.
And towards the implementations,
yes,
nationwide,
yes. Yeah.
right?
It's a key event if you when you build such an infrastructure to have this first for testing, validating that for enabling the vendors, the providers to validate their thing, also to make the community of implementers around your project. So it has a very high value. Also, aside it's not only the testing itself, it's also creating this community of, because these vendors, these software implementers will exchange information with others, and you may have problems sometimes. So it's good to have this community. And if I may complement the answer to Jan's question, two things. I was in contact with a software developer who had to develop a software for the Cara community, and Cara said, "Well, you have to use IHE profiles, etc." And we had a few discussions together. They asked me, "How is IHE? How is it structured? How do we participate to a projectathon, etc." And 8 months later, they were participating at the projectathon without any problem. The other thing I can say, the EPRIC toolkit we have developed is helping a lot newcomers in the IHE world, because they configure, they implement, of course, they configure their endpoints, and then they play the application, and the EPRIC proxy will do all the stuff linked to Gazelle. And you have one page where you see one line per transaction you have sent, and you can click on the transaction you have sent, and you have immediately the result of the corresponding Gazelle tools. So it's also one way to simplify the use of the Gazelle tools, because you have already the test is already performed with the correct validator, and you just have to click to have the result. And that's also very useful for helping them, those who do not know how to use Gazelle tools.
Thank you. There is a question from Evert, and I think it was towards Thierry. Is the national contact point part of the reference environment? And Evert, you refer to the national contact point in the cross-border exchange, right?
That's correct. But Stéphane mentioned also the national contact point, and I believe it was part of the reference environment.
It's part of the law, of the federal law. Okay. It's not part of the reference environment because Switzerland has been excluded from the cross-border a few years ago, until politics and agreements between the European Commission and Switzerland are pre-established. So it's foreseen, but it's not yet part of the reference implementation.
Okay. And in France, of course, we have a national contact point to exchange a CDA document with other European countries, and other European countries can access to the DMP, the CDA repository for two use cases, for prescription and for
patient summary.
Yes, patient summary, sorry.
Okay.
So there was another poll on what topic could a projectathon be useful. We see here cross-border. I wonder, Stéphane, in a cross-border exchange, countries without having a projectathon experience, do you think it's feasible to have European projectathons on this?
Well, the European Commission is organizing every year cross-border IHE-GSI projectathon, where all national contact points have to participate, because there is a yearly upgrade of the software infrastructure, and it's from what I know, it's mandatory for every country in operation to participate to the yearly upgrade projectathon. But it's a projectathon between the national contact points. You may then have a national projectathon that will include the link between the national NCP and the national infrastructure.
Thank you. I think indeed that would be very useful.
Do we know the use cases that are tested during the projectathon of the national contact points? And
all the use cases of the NCPs currently e-prescription, e-dispense, patient summary, and I think normally access to original clinical documents. And of course, all what relates to the patient identification, patient consent, all transactions being used between two national contact points. So it's really the national contact points trust zone. It's excluding the interfaces with the national country, but it includes the content that will be consumed by the national contact point and sent forward to the other NCP. That's included, but not the interface between the national contact point and the national infrastructure.
We have launched another poll here. What would be the main type of support you would need? You cannot check multiple options. One final question from anyone, please speak up. While we wait for that, I have a question. Could projectathons completely replace the connectathons, Stéphane?
It's not the same goal. Well, if you have an international company, in the projectathons, you will test only the specific aspects and the national specifications. You may have differences. So I would say that in this case, you will be interested also in first doing the connectathon, validating your generic implementation of the profiles. And there you will be able to, during 1 week, validate all the profiles you are using. And then you complete the gap with the national project in the projectathon, where you do the specific, the part specific to the country, where you will not test everything you have implemented. We will test the transactions required by the country or the project, the use cases of the project, the specifics from the project. So for me, it's complementary. I think it's probably a bit different for a company that is active only in one country in one specific aspect, where probably the projectathon is enough.
Yes, I think it's also complementary, especially for international or European vendors. As you said, for national vendors, for example, in France, we have also national vendors who only pass the projectathon. I mean, also it could be two-step. A projectathon, the projectathon or testing step is some steps are more complicated. Also, where in the projectathon, and of course, it's also based on the use case for defined in France. So we have use case for example, for biological report, for immunization content. So we have a special focus on some IHE profile.
You have a ground competence with the connectathon, ground knowledge of the profiles, and then with the projectathon, you add some specifics related to the project.
May I ask Charles a question a little bit different? I have heard a little bit, but not too much clarity on what you foresee the role of the projectathon to be on a sustained basis. So not to introduce a new use case, a new profile, new implementation, and deploy them as effectively as possible. But let's assume something is deployed, it has been running for 5 years. Is there still a role for the projectathon? And if so, what is it, and what do you foresee for those deployed things, the role of the connectathon to be, both to Swiss and French? Switzerland first?
Yeah, okay. First, I hope that the specifications of the project, of the platform, will evolve over 5 years, adding new use cases that will be not frozen for 5 years.
No, my question is with the same use case.
Yeah, yeah. Well, for the same use case, we see that some vendors are not coming again and again every year if there are no new use case. I think it's a pity because Connectathon and Projectathon, you are creating this community of implementers, of community of interest in these profiles, in this implementation. And even if you have nothing new, it's always interesting to have the contact with the others and building and maintaining this community of interest.
But don't vendors have new version of their product, and how do they make sure they still work in your project?
Well, yeah, that's their responsibility, of course. It's not a certification formally, the projectathon, it's a validation of their implementation. So if they change their implementation, they should come again to the projectathon, of course. I think the community aspect is very important.
What about France?
Yeah.
In France, well, we have each year we have new vendors, and we have also we have also the old vendors. We have the same on the new vendors. It depends. Yeah, for example, if a company, if a vendor have a new version, they can pass the projectathon. And also, they also come, vendors come also to exchange between other vendors, to exchange with us. It's not only a testing event, it's also an event to meet the community, and it's quite important to have a community of people. So we have many vendors are coming each year.
Okay, thank you.
You are muted, Caroline.
Thank you all. Thank you, Thierry, Stéphane, Gal. Thank you for being here, for
Thank
your
you.
questions. The recording is available, and before you go, please rate the webinar. We hope to see you in 1 month, and enjoy the end of the year.